was asked to give you an overview of what's happening in the United States. And the challenges, one of the challenges you have here are the different languages. And one of the challenges we have in the United States is the size of the country, but also the complexity of the healthcare system. So hopefully the way I've organized this will be of help to you, really trying to give you an overview of kind of how the system is set up in the United States and where acupuncture fits in there. So that's the basic idea of the organization of this talk, hopefully with the questions that you have being the more valuable. So give you an overview and then please ask questions for your specific interests. So I'll give you an overview of the health insurance organizations, the organizations that actually provide care, and then talk about two other organizations that are just helpful for you to know about. So the healthcare in the United States is usually either paid for by individual people or it's paid for by some organization, So the major ones in our country are listed here. Medicare is a federal program, and by and large, it is a program that is set up to pay for health care for the elderly and for a few other categories, such as people who are disabled. That's the basic population that Medicare pays for. So Medicare does not provide care directly. Medicare provides coverage for providers and so reimburses the providers for that care. Does that make sense? So that's what Medicare does. 44 million people, or about 15% of the U.S. population, is covered by Medicare, and it does not cover acupuncture, and I do not foresee it covering acupuncture in the near future. And this is important because most of the private healthcare insurances base much of their coverage decisions on what Medicare does. So that's an issue. Medicaid is overseen by the federal government. There's the Centers for Medicare and Medicaid nationally, but really they're state organizations. So we have 50 states in the United States, and each state is responsible for the specifics of their Medicaid program. And Medicaid also provides coverage for people who are enrolled in Medicaid, and by and large, Medicaid recipients are people with low income. So the Medicare is for the elderly and the disabled. Medicaid is statewide, varies state by state, and is for people with low income. And you will hear soon from Robert about one of the states that has that covers Medicaid and is looking to expand, but only a few states do. I don't have the exact number, but it's just a handful of states. It's growing. I'm from North Carolina, and North Carolina wishes and intends to cover Medicaid, but hasn't done so yet. TRICARE is an insurance program that is for people who are or who have been in the armed services or uniformed services or the military, all these terms. So people who have worked for the government in the military can get coverage through TRICARE, and it covers almost 10 million people, and that does not cover acupuncture. Most people in the United States who have health insurance either by a private healthcare insurance company, Blue Cross Blue Shield is a common one that you may know, Aetna, United, names that you may know here, or their employer. And so it's hit or miss. It depends on what the plan decides to do, whether or not it covers acupuncture or not. And I did want to make a point here that about 14% of people are not covered by any healthcare insurance. That is a big problem in the United States. That number has decreased over the years thanks to what's known as the Affordable Care Act or Obamacare, but there are so many people who are not covered by health insurance. And this is a quote from Wikipedia, but they also quoted a source and I looked at the source, but it was easier to quote Wikipedia. I'll read it to you. According to the Department of Health and Human Services, over 82% of large employers, offer a self-funded health plan, and over 25% of firms, moderate size, offer a self-funded health plan. What that generally means is that the employer decides to provide as a benefit to their employees health coverage. Now, many firms do that by just paying for part of the health insurance for Blue Cross Blue Shield, for example. But this is different. This is when the employers themselves are taking the risk, covering the cost. They may have an insurance company administer it, but they're still essentially the insurance company. So they make their decisions. I work for one such organization. I work for a hospital that's self-insured, and so the decisions, and we do cover acupuncture, where I work, and it's a decision made by employer to employer. This, I believe, is increasing in importance in the United States. The organizations that actually provide care include these organizations here, and I'll go over each one at a time. So the VA, Veterans Administration, U.S. Veterans Health Administration, is the system that provides care for veterans. So in the United States, we have a different, disjointed, not that well integrated, two very different systems for people for providing health care for people who are in the military. There is the people who have retired from the military, and those are veterans. They're the ones who are served by the Veterans Administration. And there are 172 VA medical centers across the country, and they cover 9 million people, and that does cover acupuncture. And it's increasing. In fact, I just saw last night a new report that just came out that surveyed the medical centers, and 88% of all VA medical centers offer acupuncture now. There's leadership within the VA that's very strong, very pro-integrative medicine, very pro-non-pharmacological approaches to treating problems. And the VA as a whole has embraced it, or at least the leadership has. There are many problems in that are being faced by the VA administration for which non-pharmacological treatments are really very, very important. The pain, opioid addiction, post-traumatic stress disorder, depression, many of these conditions for which integrated medicine, acupuncture, and other non-pharmacological approaches are very important, and that's being recognized by the VA. So I would say, this is a judgment call, an opinion, I would say they're a leader in the U.S. in this respect. I'm very, very impressed with the progress that's being made within that system in terms of integrated medicine, acupuncture, and non-pharmacological approaches. And then there's the U.S. military healthcare system. So people who are actively engaged in working in the military now, and their families are covered by the healthcare system within the military system. That's part of the Department of Defense. And the Department of Defense is a separate department than the Department of Health Veterans Affairs. So they're different. But a person will move from being in the Department of Defense when they're active military personnel to being a veteran and could get care through the Veteran VA hospital. I only know of 4 hospitals in the military healthcare system that offer acupuncture directly. There may be more. I just couldn't find that information. I know of 4. I'm going to skip down to here just to say that the reason I know is Joseph Helms is the person who has trained most physician acupuncturists like myself. I'm a physician, and I took the Helms course to learn acupuncture. We call it medical acupuncture in the U.S. And he now is very involved in trying to get acupuncture available and provided in the military system by physicians. And he has his flagship organization is in Las Vegas. It's called the Nellis Air Force Base. And he has trained, he's trained the residency directors in the medical system there in Las Vegas to train all of their faculty and all of their residents. So every family physician, rather, in this Nellis Air Force Base is trained, has basic training in acupuncture, and therefore it's available in the clinic for anybody. Any person coming in for family medicine at Nellis Air Force Base could be offered acupuncture because all of the residents and faculty are trained in acupuncture, and they call that Think Acupuncture First, and then that's now been expanded to 3 other hospitals that I know of. And then this is just wanted to cite my only citation here, because this is not so much a research talk but more an overview. Did a survey recently and identified 15,000 people who received acupuncture in the military health system in 2014. Many of you have heard the term battlefield acupuncture. You may have. That term is, I think, was coined by Dr. Neem Sao, who was in the Air Force and is a medical acupuncturist, and it refers to ear acupuncture. And that's caught on. In fact, these two people are kind of in competition and don't really overlap that much, but much of what he is now teaching these physicians are ear acupuncture by and large. It's not exactly battlefield acupuncture, he won't use that term, but basically auricular acupuncture is what's caught on mostly in both in the military system. And to my knowledge, licensed acupuncturists are still not in the military healthcare system. They're working to do it in the VA. There are some, I know of some examples of licensed acupuncturists who are providing care in the VA system. I don't know of any in the military system yet. It's more physician-centric. So academic medical centers, the term is, there's actually an official definition, but it's used more loosely by many. But really what it is, it's a combination of a medical school and a hospital and a research center. And that's what a medical center is. And there are about 120 in the United States. And to be called a medical center, you have to offer the full spectrum of health services, medical education, and medical research. And most of these offer acupuncture. I haven't seen a survey that tells me exactly how many, but I think the vast majority of them do. And I did want to make a quick point out to this organization, some of you may know about, the Academic Consortium for Integrated Medicine and Health. These medical centers and other organizations are members. Claudia, is your organization a member of the consortium? Okay, not from Switzerland. Yeah, thank you. There are some international organizations that are part of that, but this is a up and coming and I think an important organization that really kind of is helping move forward the field of integrated medicine. And then private healthcare facilities, that's where most of the care is given. This is regular doctors who are healthcare providers who are in private practice or work for nonprofits or in community hospitals. They kind of comprise the rest of the healthcare system, really, as far as delivery of healthcare. And employers, as I mentioned, are increasingly important as a direct form of healthcare. And the reason for this, I think, is historically in the United States, healthcare became a benefit to retain employees after World War II. So after World War II, there was an economic growth, and I believe that there was a bit of a shortage of labor. And one way to retain employees was to offer them health care. This was before Medicare was even developed. And so historically, since the 1940s on, employers are the main source of health care insurance in the United States until Medicare came about, and then for the elderly. And what they find is that it's less expensive. It's very, very expensive, the United States healthcare system, but it's less expensive for employers to take control directly of their care than it is to farm out the coverage to insurance companies. And that's why I think there's this larger trend. And things that have value are included, and acupuncture has value. And so many of the ones that I know about include acupuncture, promote it, and patients and employees are very happy about it. And it's one way to increase employee satisfaction and retention. I do just want to point out this doesn't fit in any of the categories I've mentioned thus far, but I think it's worth at least mentioning it. That the NIH is the largest biomedical research agency in the world, invests $32 billion a year on biomedical research. It's comprised of 27 institutes and centers that all are under part of National Institutes of Health, one of which is the National Center for Complementary and Integrative Health. And I really want to put a call out here. Dr. Langen was going to be here today, but she has since been selected and offered the job as the director of the center, which is a huge deal. One, she's fantastic. It's great for the world. It really is. Certainly great for the NIH, and great for the field of acupuncture. I mean, she now is, she was a member of the Society for Acupuncture Research. Now can't be because she is the director here. But I think it's a really, really important positive step for pretty much all of us here. And I just wanted to make point of this. And it does fund acupuncture research. decreasingly so, it seems. I mean, I think there was a period when acupuncture was funded more. We have members here who are getting NIH funding on acupuncture, but it's not exactly a growth field in my opinion. Maybe others who are doing actively in the field may comment on that. But right now, it doesn't seem to be a heyday for acupuncture-funded research by the NIH. That's my observation. Conclusions: the healthcare system is complex and complicated. Acupuncture is not covered by Medicare, by TRICARE, by much of Medicaid, but it's still being offered and people are paying for it and other organizations are paying for it. But the main ones are not covering acupuncture by and large, with the exception of the VA Medical Center, which is really doing so. I will quickly tell you here, I am a physician, an integrated medicine physician. I work at a medical school, a medical center in North Carolina, and we're in close proximity, within an hour's drive of a VA medical center. And we have a unique, very unique, there's no other such relationship in the country, but there should be, which is that veterans from the VA medical center, an hour south of us, are being referred to our clinic, our integrated medicine clinic at Wake Forest. And they're given 24 sessions already pre-authorized. So a physician at the VA Medical Center will refer a veteran to our clinic, and they will have 24 sessions completely paid for, already authorized. The first is to me, so now all of my patients are veterans, which is an incredible, really, really amazing opportunity for me to have, get to know these people. And then I basically refer them to our services. We have acupuncture, healing touch, some of you may not know, it's an energy modality, massage therapy, counseling, integrated medicine consultations, and all those are paid for by the VA system. The VA system pays us well to do that, and then that's an option for the veterans, which is a really great opportunity, and we're getting fantastic results from that. So that's another example, the VA paying cash for providing services outside of their system because they see the value in integrated medicine and acupuncture. And acupuncture is offered at most medical centers. So hopefully there's time for some questions. Okay.